from what you're doing with this. And of course, the biggest thing is that this research benefits others in the muscular dystrophy community as this information goes out and ultimately will be in future clinical trials. And at some point, we want it to be able to eventually impact what is being done for clinical care. This is a research study, so it's not any clinical care that's done, but all research-based. And this reviews, again, exactly what I went through. It repeats it twice as far as what we're going to do. And it talks about a saliva sample. We're not going to collect saliva, so I didn't mention that because we're not going to do it. Information that we collect is information that has some sensitive type of items, such as your date of birth and some other medical history. So we make sure we separate everything and keep things locked up and secure. As far as information that's shared, information may be shared with the study sponsor or U.S. governmental agencies such as the Food and Drug Administration, the Department of Health and Human Services, or the Office of Human Research Protections. And I mentioned that the study you'll be in for these will be for 2 years, one of them coming for every year. This other one I'll talk to you about is every 6 months. And again, it mentions about the discomforts and risks for a second time with things. And
every 6 months I have to be here.
For one of the studies, it is for a 6 month that we'll talk about. This one's for every year. So this one is looking for up to 4 different visits in 2 years if it's possible to come.
Yeah, this was I come.
Okay. And the benefits that we already had talked about, the other benefit is that we who run the research study, Dr. Vanderborn and the team, this, of course, research is good for our career and her career because then she goes out and presents these findings to all kinds of different conferences and publishes the findings as well. If at any point in time you want to stop being in the study, you can. You can withdraw from the study. Anything that would already collected would stay in the study, but if you need to withdraw, you can do so at any time. And it does mention about the principal investigator may need to withdraw you. So if you couldn't be in the study for something because it was unsafe, we would stop. We wouldn't want to put your health at risk of any kind. We would withdraw you if it was needed. You should get no bills for the study, so your travel and everything should be paid for. And then for this study, there is also a gift card that Onima has in the folder that we'll get to you as well. And then it mentions anytime, and it's in all 3 of these, anytime that we test humans in any research study, there's always a statement that the University of Florida has us put in that says if you were injured as a direct result of participating in this study, professional services that you receive at the University of Florida Health Science Center would be provided to you without charge. We don't anticipate you injuring yourself or anything, but that's always there in case, okay? So that's this first study. I'm going to talk a little bit about these others, then we can have you sign all 3. Is that okay? Yeah. Okay. So let's put this here. And actually, let's do it in this order. Just so that I fill all this out. And NIRMAL, make sure that I spell everything correctly. And KHADKA, excellent. So this study is very similar to what we're going to do here. It just has, some of the images are just a little different that we'll take. But it's still Dr. Vanderborn who's in charge. It's the university's paying for it. And the other big difference is that this is another company called Edgewise Therapeutics. So some of this information will go to them as well as they're collecting information and they're helping people. That's the biggest difference. But in general, it's the same kind of things that you're going to go through. The only items is that you may be coming back instead of every year for this visit is every 6 months. But the risks are the exact same. The procedures really are the same here as well. And the 6 month visit is actually an optional visit. So my guess is with the distance that you live is they probably would have you just come at baseline 12 month and 24 month would be my suspicion. But Kathy and the others can talk to you a little bit more about that as that gets a little closer, okay? But the type of items that we're going to do are going to be the exact same as far as the functional measures, the imaging, and everything else, with the exception of just a few other small images that we do in the magnet itself. It's the same kind of information with regards to the breathing, with regards to your date of birth, medical history, and these kinds of items. The information will be shared. Again, the only big change is that this information will be shared with this company, Edgewise Therapeutics, as well. But you're in the study, as I had talked about, the same. It repeats the discomforts and risks, which again are the same as what we covered already. The benefits are all the same as what we talked about. You can still withdraw at any time if you'd like to. There should be no bills that you receive, and your travel would be taken care of for the study as well, of course. And then it has the exact same language as if you're injured, you would receive health care at the University of Florida Health Science Center at no charge if you're injured as a direct result of participating in the study.
And Edgewise is also is here, or where is the company?
Is what's that?
Edgewise company, where is?
Where is it?
Yeah.
Edgewise, you know, I am not exactly sure where Edgewise is. I was going to say California, but I'm not sure if that's, and it doesn't say it in here. I'm not sure where they're physically located, Edgewise. Because they collaborate in different means. So, well, a lot of times now with the company, even though they're in a physical place, sometimes they may have 10 employees who work there, and then they have 10 others who work all across the country because everything's done virtually. I believe it's California, but I'm not 100%. But I can look that up for you if you'd like to know.
I heard that Edgewise is doing clinical trial in Grand Canyon.
That's correct. And so that's what this information is so important, so that it can be utilized for looking at where it's going to go for other clinical trials in the future.
Yeah.
Yes, that's correct.
Yeah, I saw that one.
Good.
I heard that in Arizona when I was last year. I was in Arizona.
Oh, you were there?
Yeah.
That's great. That's great. Any other questions about this study?
No.
Okay, we'll get some stuff here. This is a small consent form here. Let me make sure. Again, NIRMAL and KHADKA. So this is a study, but really what it says is this is the information that we collect on the imaging, the information we collect with the urine and the blood. This consent form says that it's okay to not only use in these studies, but that if for any that's left over, we can store it in what's called a biorepository, so that it would have your blood, your urine that could be matched with your medical history and the images, so that when Dr. Vandenborn, Dr. Walter, and other people in the group say, 2-3 years from now, they say, here's another really important question that we should ask, they already have your urine, your blood, the images, that they can start utilizing that to answer questions. Because they don't say, hey, Nirmal, can you come back again 3 years from now? So they're already able to have that information. That's what this is in essence. Any concerns with that?
No.
So I'll mention, it does mention about blood and urine. It also talks about saliva. We're not going to collect any saliva when it says that. And if you need to change your mind or want to, you can talk. There's a phone number for Dr. Vandenborn. You can call and say, I don't want my information kept anymore, and we would discard it. It'll be kept in this biorepository that's actually physically here on campus. And then, similar to before, what would be shared with others, this information could be shared with government agencies to, again, expedite or help to move things forward so that clinical trials could proceed at a little bit quicker pace with things.
I don't know. I don't mind. It's okay.
All right. And then it has...
It will be useful for other, I don't mind.
Perfect. And the only other thing is it has the same language that is these other two, that if you're injured as a direct result of participating in the study, that you'd get healthcare services here. Well, I will go ahead and sign some of these saying that I had gone through them, unless you have questions about anything.
No, I'm okay. It doesn't matter if it will benefit for other, and it is a good thing.
It is. It is. And so what I'll do, if it's okay, if there's anything that you'd like to look at further, please do so.
No.
And this one would have you sign and date here.
You can write date there.
Do you want me to write the date?
Yeah.
And what's easiest for you to sign? Do you want me to scoot a little closer?